Good morning, everyone. I apologise in advance if I'm a bit hoarse today. I want to thank from the heartfelt thanks to Minister Butler for coming today. I apologise in advance if I'm a bit frank and fearless, but I assure you it's less so than last year. And Richard, I'm so glad you didn't turn your coat inside out. This is not a pink event. And I just want to acknowledge Minister Wilkie's beautiful words. They couldn't have been more touching to all of us, and we're just so grateful that there is a parliamentarian who is really on board with what we're saying. So every November, when Sydney turns purple beneath a canopy of jacaranda blossoms, I'm reminded how beauty and heartbreak can arrive hand in hand, for it was beneath those same blooms that my husband's journey with cancer, glioblastoma multiforme, began in 2006. 2.5 years later, in the quiet of winter, he passed away, as if the world had dimmed after that brilliant bloom. Himself a world-renowned cancer surgeon, and at 54, and at the height of his career, he was diagnosed. His diagnosis was like a hammer blow, as all of you will know. Comes out of the blue. I could never have imagined then what has happened in the 19 summers since. Besides being deeply involved from the time of his death in the realization of his dream, which was the creation of a comprehensive, fully integrated, multidisciplinary, holistic cancer centre for the people of New South Wales and Australia, which is now called the Chris O'Brien Lifehouse, I have become an advocate and voice for those people, patients and families suffering from cancer and struggling to navigate the health system. Many of these people have brain cancer, for whom, unlike other cancers, a diagnosis is an existential crisis that throws all the family into the depths of despair. I hope that the gifts of professional insight and lived experience which converge here will ensure that the stories, struggles, and hopes of these people are heard and respected. I spoke here last year, so thank you for having me back again, Craig, and the BTAA committee. And I've been interested to observe any changes in the last 12 months in regards to navigation and supportive care services for brain cancer patients in Australia and in research. I'm very pleased to report that on September 3rd this year, Prime Minister Anthony Albanese, together with Federal Minister Mark Butler, Health Minister, announced federal funding for $5.9 million over 5 years for an academic chair in brain cancer research with Chris O'Brien Lifehouse, Royal Prince Alfred Hospital, and Sydney University. It is to be named the Professor Richard Scolyer Chair in Brain Cancer Research. This is a massive step forward, and I'm very grateful to the federal government for seeing the value and accepting this proposal. I also want to thank Richard and Katie so much for allowing us to put Richard's name towards this initiative, because I know that this will inspire and help many people in the future. Thank you, Katie and Richard. As both a health professional myself and someone who has walked the harrowing path of personal loss, I'm pleased to stand with the Australian Brain Tumour Collaborative, which was created in 2022 to bring together the many dedicated organisations, support groups and researchers who share a common goal to improve the lives of people affected with brain cancer. So the second piece of good news is the very positive meeting with Minister Butler that I was privileged to attend on October the 13th with the Brain Tumour Collaborative, led by Craig Cardinal, who I applaud because he has tirelessly given his time voluntarily to this cause for years. It's a cause worth fighting for. And due to the Minister's receptivity, there was a sense among the collaborative, who are here today, that this was a watershed moment for brain cancer. But there's still much to be done. The fight against brain cancer, like all great human struggles against disease, must be waged on two fronts. In one corner stand the laboratories, the peer-reviewed journals and sacred data, the priests of empiricism, wrestling with the unknown. But the work of science alone does not carry the whole moral weight of this battle. Beyond the labs and the grant applications and the clinical trials lies the far less tidy realm of human endurance, the crash landings into emergency, the long sleepless nights beside a hospital bed, the quiet heroicism of those who care for a mind being unstitched by the disease itself, and the body bewildered, and once the instrument of will, becomes a hollow echo of all that it served. Medical research gives us hope in the abstract, but caregiving gives hope its shape, its vocabulary, and its humanity. To ignore the latter is to forget what the science is for, not merely to extend life, but to dignify it. Therefore, it would be nothing short of catastrophic if the National Advocacy Service, that slender but vital thread connecting families to a labyrinth of supportive services, were to be severed. Chris O'Brien Lifehouse also relies on the services of the Peace of Mind Foundation in Canberra, which is part of the National Advocacy Service, and collaborates with the Cure Brain Cancer Foundation for our brain cancer patients. To contemplate its defunding is to flirt with a quiet kind of moral vandalism, the deliberate dismantling of a mechanism that helps the voiceless to be heard. There's more bad news on the horizon. Ability First, who manages the younger person's ACAT pathway, that's an acronym for Aged Care Assessment Tool, have confirmed, and I've spoken to the CEO directly, that the program is closing as of November 1st, 2025, so in 4 days' time. This pathway has played a critical role in supporting individuals aged 65 and under who were unable to return home following hospital admission and for whom the NDIS was not appropriate. It has often been a vital option for our younger patients with brain cancer whose significant loss of function meant returning home was not feasible and who required a higher level of care than community programs could provide. With the closure of this pathway, these patients will no longer be eligible for transition into a care facility. This change will have serious implications, particularly for those who need 24-hour care and do not meet NDIS criteria. As a result, we can expect longer hospital admissions due to lack of suitable discharge options, increased strain on inpatient services, pressure on families and carers, gaps in support as programs such as compacts and safe supported at home, SASH, are not equipped to provide high-level or continuous care. This is likely to be a brutal realization for the system, as we currently have no clear alternative to fill the gap that the younger person's ACAT pathway will leave behind. Despite brain cancer being the leading cause of cancer-related deaths amongst children and adults under 40 in Australia, it continues to confront significant barriers such as this. Unlike many other cancers, there are no preventative screenings or lifestyle changes that can mitigate the risk. A diagnosis brings an immediate and often devastating decline in quality of life, stripping individuals of their driver's licenses, employment, independence, and essential cognitive functions. The immense burden of care falls squarely on the families who are frequently unprepared to navigate a complex healthcare system and struggle to access the resources they so desperately need. Yet despite its brutal toll, brain cancer still finds itself relegated to the sidelines of funding priorities, overshadowed by more common afflictions. With just 1,500 to 2,000 new diagnoses each year in Australia, it's a rarity. That's no debate. but it feels as though it's an excuse for negligible government support, a cruel calculus that ignores the sheer devastation wrought on patients' independence, dignity, and their families. These patients are not faceless statistics, but contributors to society, taxpayers stripped of their autonomy. Their care deserves to be more than an afterthought. It must be a moral imperative to counter the ravages that they and their loved ones endure. On July 17, 2008, the Australian government ratified the United Nations Convention on the Rights of Persons with Disabilities, CRPD, a gesture meant to enshrine the principles of inherent dignity and non-discrimination for all individuals with disabilities. This framework underpins the Australian National Insurance Scheme, the NDIS, ostensibly designed to provide funding and support for those living with disabilities. And yet, for all of its lofty promises, the reality for brain cancer patients is a damning indictment of, bureaucratic blindness. Despite suffering from severe neurocognitive impairments that shatter their careers and strip them of societal participation, much as my late husband, Chris, was forced to abandon his work overnight and said to me, someone here reminded me today, if it's this hard for us, how is it for everybody else? Brain cancer patients are often denied recognition as disabled. This stark exclusion from the rights and support afforded to others underlines the desperate need for reform. Brain cancer patients must be granted the same dignity, protections, and support extended to others with disabilities. Anything less is a betrayal of what the CRPD professes to stand for. While the establishment of the NDIS marked an important step forward towards lifetime care and support for individuals with significant disabilities, it remains riddled with glaring shortcomings of which I know the government is aware. I know from my work as the patient advocate at Gail O'Brien AO that accessing NDIS services for our young brain cancer patients is an exercise in frustration and futility. And that's why we have relied so heavily on the well-respected National Advocacy Service to help our patients, but now, as I mentioned previously, their funding is about to cease. When families cannot manage care at home due to limited support, they're left with few alternatives. Brain cancer patients are effectively stranded. This harsh reality reveals a glaring gap in the system and underscores the need for relentless advocacy to secure equitable access to essential services so that those stricken with brain cancer don't become a lost cause. I believe that only organizations that possess a deep, unflinching understanding of brain cancer, its brutal progression, its devastating cognitive and emotional toll, its peculiar needs, should be entrusted with the managing and distributing funds earmarked for this unforgiving disease. To hand these to umbrella bodies is not to know brain cancer. Brain cancer demands precision focus and an intimate familiarity with the ways patients and families suffer and survive. Its devastating nature demands specialized care models and targeted resources. Tailored investment in brain cancer could deliver life-changing care for fewer patients with comparatively less funding, addressing both their complex medical demands and the catastrophic toll on their lives. There is an urgent need for care coordinators who can replicate the success of the McGrath Foundation model, but with critical adaptations for the intricate and unforgiving demands of brain cancer. I'm going to suggest that the Peace of Mind Foundation partner with the McGrath Foundation. A virtual hotline providing immediate support could serve as a lifeline for patients and families lost in this maze. But even more crucial is consistent access to an integrated work of specialists, OTs, nurse practitioners, neurophysiologists, memory clinics, and supportive care services. Only through this kind of tailored and readily accessible support can the multifaceted challenges faced by brain cancer patients be met, ensuring they're not abandoned to navigate their care in isolation. The time has come for meaningful investment in brain cancer coordination, support, and systems that truly reflect the severity and unique challenges faced by patients and their families today and not in some distant future. So I conclude with the good news that our visibility, our collaboration, and sustained advocacy is driving change. Our shared focus does bring hope that it won't take another 2 decades of jacaranda summers until we see a more equitable system. Thank you, everybody.